Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Are eggs bad for your heart? Results from a prospective controlled trial presented at the American College of Cardiology's annual scientific session revealed that over a 4-month period, cholesterol levels were similar among people who ate eggs most days of the week compared with those who didn't eat eggs. Eggs are a common and relatively inexpensive source of protein and dietary cholesterol. Whether you like your eggs sunny side up, hard-boiled or scrambled, many hesitate to eat them amid concerns that egg may raise cholesterol level and be bad for heart health. We know that cardiovascular disease is to some extent mediated through risk factors like high blood pressure, high cholesterol, and increased BMI and diabetes. Dietary patterns and habits can have a notable influence on these, and there has been a lot of conflicting information about whether or not eggs are safe to eat, especially for people who have or are at risk for heart disease. This is a small study, but it gives us reassurance that eating eggs is okay with regard to lipid effects over 4 months, even among a more high-risk population, said Nina Novaresh, MD, a PhD fellow at the Duke Clinical Research Institute in Durham, North Carolina, and the study's lead author. A total of 140 patients with or at high risk for cardiovascular disease were enrolled in the Prosperity trial, which aimed to assess the effect of eating 12 or more eggs a week versus a non-egg diet, that is consuming less than 2 eggs a week, on HDL and the LDL cholesterol, as well as other key markers of cardiovascular health over a 4-month study period. Secondary endpoints included lipid, cardiometabolic, and inflammatory biomarkers and levels of vitamins and minerals. Patients had in-person clinic visit at the start of the study and visit at 1 and 4 months to take vital signs and have blood work done.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possess in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Can sweeteners raise your appetite level? A study published in the journal eBiomedicine revealed that replacing sugar with artificial and natural sweeteners in food does not make people hungrier and also helps reduce blood sugar levels. The research trial, led by the University of Leeds in collaboration with the Ronne Alps Research Center for Human Nutrition, found that consuming food containing sweeteners produced a similar reduction in appetite sensations and appetite-related hormone response as sugary food, and provides some benefits such as lowering blood sugar, which may be particularly important in people at risk of developing type 2 diabetes. However, the use of sweeteners in place of sugar in food can be controversial due to conflicting reports about the potential to increase appetite. Simply restricting sugar from food without substitution may negatively impact its taste or increase sweet cravings, resulting in difficulty sticking to a low-sugar diet. Replacing sugars with sweeteners and sweetness enhancers in food product is one of the most widely used dietary and food manufacturing strategies to reduce sugar intake and improve the nutritional profile of commercial foods and beverages, said lead author Catherine Gibbons, Associate Professor in the University of Leeds School of Psychology. Mental health may predict heart health in younger women, finds study. A new study presented at the American College of Cardiology's annual scientific session found that having anxiety or depression could accelerate the development of cardiovascular risk factors among young and middle-aged women. Younger women are generally thought to have a low risk of heart disease, but new research urges clinicians to revisit the assumption, especially for women who suffer from certain mental health conditions, and reported that younger women with anxiety or depression were nearly twice as likely to develop high blood pressure, high cholesterol, and diabetes over a 10-year period compared with women who did not have these mental health conditions, putting them nearly on par with men on the same age in terms of heart disease risk. We often feel that young women are the safe group with regard to cardiovascular disease because the incidence of cardiovascular disease is quite low due to the protective effects of estrogen in this group. But this study suggests that if a younger woman has depression or anxiety, we should start screening for cardiovascular risk factors to reduce the incidence of cardiovascular disease, said Giovanni Schiveri, MD, cardiologist, research fellow at Massachusetts General Hospital and Harvard Medical School, and the study's lead author. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.